Hi, so today we would like to discuss the topic of what your doctor should do if you are experiencing a threatened early miscarriage. So what is a threatened early miscarriage? So a threatened early miscarriage, we cannot classify it as a miscarriage because miscarriage has not happened yet. But a threatened early miscarriage means a potential miscarriage might happen because patient is experiencing symptoms such as a light vaginal bleeding and some mild abdominal pains, which is indicative of a potential miscarriage that might happen. So threatened early miscarriage usually happens within the first trimester, which means week 0 all the way to week 12. If it happens in this stage, we will call it a threatened early miscarriage. So as long as your pregnancy goes past the first trimester, it is usually very stable because the placenta is already fully developed by week 12, and it is stable pregnancy and almost very difficult to become a miscarriage. So if a miscarriage is about to occur, it most likely will occur during the first 12 weeks. So if you know somebody or your partner is actually experiencing symptoms of a potential threatened miscarriage, quickly bring them to the nearest hospitals to get the appropriate treatments. Now, a lot of doctors will not take it seriously, but here at Antai Hospital, we know that almost 80 to 85% of threatened early miscarriages, if diagnosed properly, can be prevented. So your threatened early miscarriage will not develop into an inevitable miscarriage. This is what we can guarantee. But we are not saying that all threatened early miscarriages can be prevented. There are, in rare cases, 10 to 15% of certain threatened early miscarriages that cannot be stopped. Either the cause is unknown, or the threatened early miscarriage has developed into a very severe and advanced stage that doing nothing will stop it. So one of the most common causes for a threatened early miscarriage is a immunity factor, which is the immunological factor. Antai Hospital has our patented immunotherapy. As long as we administer this to the patient, the symptoms will alleviate, and then the pregnancy will stabilize very quickly. So now, the second common cause for a threatened miscarriage is due to corpus luteum insufficiency. Now, corpus luteum insufficiency means the corpus luteum is either not developed well or too small, affecting the progesterone levels of a pregnancy. Now, we know that progesterone needs to be very high for a healthy pregnancy. So there might be some underlying diseases such as PCOS, chocolate cyst, pelvic adhesion, premature ovarian insufficiency, intrauterine adhesions, all of this that can affect the corpus luteum. So do not worry, even if you have these diseases, we will not ask you to go for surgery at this time. Surgery is not really advised during pregnancy, but what we can do is that we will supplement you the progesterone that you need. So you have low levels of progesterone, right? So all we need to do is to supplement it, give you the optimum level that you need, and your pregnancy will stabilize. Now, we do not even need to do this throughout the pregnancy. All we need to do is maintain this towards week 12, where the placenta will be fully developed and it will kick in. It will start producing the progesterone itself, and usually at this time it is very healthy and very stable. Now, I hope that this video can give you an awareness and give you an understanding that no matter how small the pregnancy, no matter how early, it is still a small and valuable and precious life. So we need to cherish this, and we need to take every potential threatened miscarriage seriously, because almost 80 to 85% of them can be saved.